Understanding ADHD. Insights from CDC data. Written by Paul Moon. Attention Deficit Hyperactivity Disorder (ADHD) is a prevalent neurodevelopmental condition impacting millions of individuals in the United States. Drawing on data and statistics from the Centers for Disease Control and Prevention (CDC), a deeper understanding of the multifaceted aspects of ADHD emerges. Prevalence and Demographics. According to a national survey from 2016 to 2019, an estimated 6,009.8% children aged 3 to 17 years have been diagnosed with ADHD. This encompasses 265,000% in the 3 to 5 age group, 2.4 million 10% in the 6 to 11 age group, 3.3 million 13% in the 12 to 17 age group. Additionally, boys 13% are more likely to be diagnosed with ADHD than girls 6%. Racial disparities also exist, with Black, non-Hispanic children and white, non-Hispanic children more often diagnosed 12% and 10%, respectively, than Hispanic children 8% or Asian, non-Hispanic children 3%. State-based estimates and treatment variations. Estimates for ADHD diagnosis among children aged 3 to 17 years vary significantly by state, ranging from 6% to 16%. Similarly, treatment rates also exhibit considerable disparities. Any ADHD treatment among children with current ADHD varies from 58% to 92%. ADHD medication usage ranges from 38% to 81%. ADHD behavior treatment spans from 39% to 62%. Treatment patterns and gaps. A national parent survey from 2016 reveals treatment patterns among children to see 17 years with current ADHD. 80% were taking ADHD medication ages to C5, 18%, ages 6 to 11, 69%, ages 12 to 17, 62%, 47% received behavior treatment ages to C5, 60%, ages 6 to 11, 51%, ages 12 to 17, 42%. In total, 77% were receiving treatment, with 30% treated with medication alone, 15% receiving behavior treatment alone, 32% receiving both, and 23% receiving neither. Services received by children with ADHD. An in-depth national survey from 2014 highlights the services received by children aged 4 to 17 ever diagnosed with ADHD. Almost 9 out of 10 received school support. About 6 out of 10 received some type of behavioral treatment or skills training. Healthcare claims data and treatment disparities. Healthcare claims data suggest disparities in ADHD treatment. Children aged to C5 covered by Medicaid were twice as likely to receive clinical care for ADHD compared to similar aged children covered by employer-sponsored insurance. Only about 3 in 4 children aged to C5 receiving clinical care for ADHD received medication, while fewer than half received psychological services. References: Bitskor H. Clausenau, Lichstein J. et al. Mental Health Surveillance Among Children United States. 2013 c. 2019. MMWRSUPPL. 2020 to 71 to 48. Danielson M.L. Holbrook J.R. Newsom K. Karania S.N. McCord R.F. Kogan M.D. Blumberg S.J. State-level estimates of the prevalence of parent-reported ADHD diagnosis and treatment among U.S. children and adolescents. 2016 c. 2019. Journal of Attention Disorders. Published online May 22, 2022. Danielson M.L. Bitskower H. Jihan R.M. Holbrook J.R. Kogan M.D. Blumberg S.J. Prevalence of Parent-Reported ADHD Diagnosis and Treatment Among U.S. Children and Adolescents. 2016. Journal of Child and Adolescent Psychology. 2018. For 199-212. Danielson M.L. Visser S.N. Cronus Tuscano Dupal G.J. A National Description of Treatment Among United States Children and Adolescents with Attention Deficit Hyperactivity Disorder. The Journal of Pediatrics. 2018 Gen 190-40-146.E1. Visser S.N. Danielson M.L. Hwol R.A.H.M.L. Fox M. Gross S.D. Vale Law. Holbrook J.R. Clausen A. Peacock. P. Vital Signs. National and state-specific patterns of attention deficit hyperactivity disorder treatment among insured children aged to c. 5 years United States. 2008 c. 2014. Morbidity and Mortality Weekly Report MMWR. 2016 65. 443 c. 450.